Joining us today is Dr. Cameron Keeney with the Center for Sleep Apnea. Cameron, many people suffer from sleep apnea. First, tell us what it is.
Sleep apnea is basically just when the airway collapses backward at nighttime. The tongue, the lower jaw fall back, the airway just kind of starts to narrow, and then breathing either stops completely, or sometimes what will happen is the airway will just shut off a little bit, which is still a form of sleep apnea. A lot of times that sounds like snoring, but it's still sleep apnea. And so basically it's just you're not breathing as well as you should.
What are some symptoms that people should look for?
So snoring is a big one. If there's a stopping of breathing or gasping for air, sometimes people will feel tired throughout the day, but not always, but a lot of times they will. A lot of people that are overweight or older might have sleep apnea. Being a male, unfortunately, that gives us an extra strike as potentially having sleep apnea. Acid reflux, high blood pressure, those are all things that are highly related to sleep apnea.
What are some ways to treat or manage sleep apnea?
So there's a couple different things that can be done. Usually the gold standard is what's called a CPAP machine. Basically it's a machine that takes and pressurizes room air, pushes it through a hose to a mask on the face, and pushes air down the throat. It works really effectively for people that tolerate it. Unfortunately, a lot of people just don't tolerate it that well. Also at my office, what we do are dental appliances. They kind of look like a mouth guard. They go on over the teeth. They help keep the jaw from falling backward into the airway in the first place. There are some surgical options also. Unfortunately, the surgical options don't tend to be the best at treating sleep apnea long term. So usually CPAP or a dental appliance are our best options.
Real quickly, does insurance cover this treatment?
Yes, good question. So medical insurance does cover treatments for sleep testing, CPAP treatment, dental appliance treatment at my office, all covered under medical insurance.
All right, thank you so much for being here. For more information, call the Center for Sleep Apnea. Have a great day.